Namaste and welcome to another episode of Diabetic Care India. I'm sure many of you have watched our episode on HbA1c. So I won't be surprised when you ask me the next question. What are the other tests that a diabetic needs to do? When and how? Alright. So HbA1c, as you would have by now realized, needs to be done around once in 3 months, but not practical that you spend this amount of money on just one test every 3 months. Many of you would be able to afford it, but a big chunk of the Indian population wouldn't be able to afford spending 500 or 600 rupees every 3 months for just one test alone. So I, as a matter of policy, don't advise my patients to do it every 3 months. But there are certain tests that all diabetics need to do at the time of diagnosis and then at regular intervals. So what are they and how are they to be done and how often? So these will be the questions we try to answer in this episode. Alright. So let me start with what are the mandatory tests for all diabetics, no matter what. So if you want to do a basic workup for the sake of evaluating or just seeing where your diabetes stands, then you have to do these tests. Kindly grab a paper and a pen and make a note of these tests. I'll try to be as concise and as clear as possible, but just in case I am not, please don't hesitate to ask your doubts in the comments section and I'll try to clarify them. Alright, so here we go. 1. All diabetics have to do a complete blood count. That is a CBC. Alright. So you go to any good laboratory, they know precisely what a complete blood count means. So you don't have to worry, just tell them CBC. So that's number 1. Number 2, you have to definitely do an HbA1c, about which I have posted an exclusive episode. Please watch it if you have not yet. That will give you all the details about what is HbA1c, why is it done, and what are some of the pitfalls and some of the benefits of doing HbA1c. Alright. So you have complete blood count, you have HbA1c. Number 3, a fasting blood sugar and a PPBS. That is postprandial blood sugar. It might not be possible for you to do the fasting blood sugar and a postprandial on the same day that you do other tests. So it's alright if you do the fasting and PPBS on a separate day, that's all right, but try to do it on consecutive dates also. So you have a complete blood count, HbA1c. Next, it is a must to do lipids. Some people pronounce or call them lipids. They are one and the same, just means the various types of cholesterols in your blood. So what are we looking at? We are looking at total cholesterol, triglyceride level, HDL cholesterol, LDL cholesterol and VLDL. These 5 have to be done. Now, do you need to do them in a fasting state? Not always. All diabetics need not do the lipid profile in fasting. You should, but ask your doctor whether you need to do it in a fasting state or not. Some patients will require fasting, and in that case, you might need to fast for 12 hours. So 12-hour fasting is important. Let's go back, rewind a bit. So you have complete blood count, you have HbA1c, you have fasting blood sugar and PPBS, and you have lipid profile. Just rewind a bit, fasting blood sugar. What exactly is fasting blood sugar? By definition, it means no caloric intake for at least 8 to 10 hours. So you can drink water before you go to do your fasting blood sugar. Alright, you can drink plain water but nothing else. Because if you were to drink tea or coffee like we all do in the morning, before doing your getting your fasting blood sugar sample taken, then it will definitely interfere with your results. So please keep that in mind. Yes, so we have talked about lipids. All the 5 have to be done. Please don't do just a total cholesterol. It's not going to be of any use to you. It won't help the doctor either. All right. So do a lipid profile. That's called a lipid profile. And a liver function test is mandatory for all patients. So liver function tests comprise of a group of tests which help us evaluate the condition, the functional condition of your liver at that point of time. Commonly done tests, so shouldn't be an issue. Next, renal function tests. It's also called a renal profile. That gives us a lot of information about the status of your kidneys. So what are the commonly done renal function tests? The commonly done renal function tests, RFTs, would be urea, creatinine, uric acid, and what is called a urine AC ratio. These are the basic renal profile tests. Depending on your requirements, your doctor might choose to add some tests for their renal profile, but these basic tests have to be done. In the blood, it is urea, creatinine, and uric acid. I repeat this because many patients have come to believe that renal function means creatinine or creatinine means renal function. Wrong. Creatinine gives us only a limited information about the renal, that is the kidney status. So please don't depend only on creatinine levels to evaluate your kidney status. That would be a big mistake. Kindly keep that in mind. Alright. So that is another important test. Next would be a thyroid profile. So do we need to do a thyroid function test in all patients? No. You don't need to do a thyroid function test, that is T3, T4 and TSH in all patients, but a TSH is important. Alright. In a selected category of patients, the doctor might decide for the entire thyroid function tests and also some additional tests with regard to your thyroid, but that is quite rare, quite unusual. Not all patients will require it. So this is another blood test that we order. Then, depending on the patient, we might decide to add certain blood tests. So what are they? Some patients might require a vitamin B12 estimation. That depends. Not all patients would require that. But the initial list of blood tests are the ones which all patients, irrespective of their status, needs to do. Now, let me repeat them for you. You have a complete blood count, you have HbA1c, you have fasting blood sugar and ppbs, lipid profile, liver function tests, renal profile, which comprises of urea, creatinine and uric acid. This is only about the blood, mind you, keep that in mind. Then thyroid function tests, though not all, but TSH is a must. TSH. So make a note of it, please. TSH. These are the basic blood tests that we need to do in all diabetics. Then in addition, we might need to do certain other tests in certain categories of patients. So we individualize them. Next, let's go to the urine tests which are required. Urine tests, pretty straightforward, quite simple. All that you need to do is a urine routine, alright, urine analysis, routine urine analysis, along with what is called albumin creatinine ratio. These are the basic tests. An albumin creatinine ratio is a must in all diabetics. In certain patients, depending on the requirement, your doctor might advise you to do some other tests. For instance, there are certain patients in whom we might request a 24-hour urine protein excretion. But again, that's unusual, not all patients will require this. Now, what are the other mandatory tests for diabetics? Today, there are recommendations that make it mandatory for all diabetics to undergo ultrasound of the abdomen, that is ultrasonography of the abdomen. All diabetics, there are certain authorities who recommend that all diabetics be sent for ultrasonography, but it's not a very practical idea, especially in a poor country like India, where many patients have to pay out of their own pockets. They might not have insurance coverage. So though it is a cheap investigation, rather cheap, an ultrasonography, even in the best of hospitals, shouldn't cost you more than 1,000 bucks, right? 1,000 rupees. But it's difficult. Subjecting each and every patient to a routine ultrasonography is not practical. Next important mandatory test to do would be an ECG. An ECG is a must. There are some patients who seem to believe that ECG is to be taken only if they have chest pain. Wrong. An ECG, a baseline ECG, is a must for all diabetics, and at times it gives very valuable information. Next, at the time of diagnosis, an ophthalm, eye examination, eye checkup, a checkup of your eyes is mandatory. And if your blood sugars are not controlled, then your doctor might advise you to wait until they are well controlled before sending you for an eye checkup. But an eye checkup is a must. Next, your foot, the feet have to be examined. That's another absolute requirement. So what are the tests that we do for the feet? Do we send all of them for scans? No, we don't do that. We do a screening for the loss of protective sensation. We call it LOPS. And the test that is usually done is what is called a biotensiometry, more technically called as a vibration perception threshold, VPT. So over here we are trying to figure out whether your nerves are functioning properly and then required protective sensation in your feet. If your protective sensation is lost, then you are at a very high risk of developing problems in your feet. And then we do what is called an ankle brachial index. So these are the bare minimum tests to be done for all diabetics. In addition to this, as I started pointing out to you, we might need certain tests in certain categories of individuals. For example, in diabetics with foot involvement, that is the foot, I'm talking about the feet, we might request for x-rays or specific types of scannings, like in certain patients CTs, but in many patients MRIs, wherein we suspect extensive soft tissue infections or something like that. In certain patients in whom there is advanced involvement of the blood vessels, then we might ask for peripheral angiograms. But it's not very common, not routinely done in all patients. In certain categories, we might ask for MR, angio, or even otherwise angiograms. These are the bare minimum laboratory tests. I have deliberately touched upon only the laboratory tests. I am not dealt with the other examination, the clinical examination that is to be done on diabetics. That will be dealt with in a separate episode. I hope you have made a note of these tests, because keeping yourself aware is the first step in taking care of your problem, right? Awareness is power. We at Diabetic Care India are trying our best to create awareness amongst the public about perhaps a disease which is the most misunderstood, right? Diabetes, I would say, is one of the most misunderstood medical conditions on the planet. All sorts of misconceptions, all sorts of misunderstandings, all sorts of mistakes people make because they are not aware of what exactly diabetes is and how to go about it. So let this be the beginning of an entire life's journey wherein you are very clear about what diabetes is, what it does to you, what you can do about it, how you go about tackling it, and all that. So hope you have made a list of this. Kindly reach out to us through the comment section with your feedback, with your comments, criticism, any type, compliments, criticisms, all these are welcome. And questions, please do post them here for the benefit of others. Thank you so much. നിങ്ങൾ ഈ കണ്ട വീഡിയോ നിങ്ങൾക്ക് ഇഷ്ടപ്പെട്ടെങ്കിൽ ദയവായി നിങ്ങളുടെ ബന്ധുക്കൾക്കും നിങ്ങളുടെ സുഹൃത്തുക്കൾക്കും ഇത് കൈമാറുക, അവരുമായിട്ട് ഇത് ഷെയർ ചെയ്യുക, ഇതിന് സബ്സ്ക്രൈബ് ചെയ്യാൻ അവരെ പ്രേരിപ്പിക്കുക, കൂടെ ഇതിൻ്റെ കൂടെ കാണുന്ന ആ ബെൽ ഐക്കൺ ഒന്ന് ക്ലിക്ക് ചെയ്യാനും പറയുക. വളരെ നന്ദിയുണ്ട്. നമസ്കാരം.